Psychoanalysis technique, continuing our sessions in the area of technique in psychoanalysis. Today we'll take up a very important part of all that we call technique, and that is the psychotherapy process. The psychotherapy process can be taken to be a synonym of technique in a way. We'll take a look at what the psychotherapy process is all about, what are its constituents, and then go into details of each of the constituents. What we will not go into full details of will be all the concepts which are used in doing therapy. That part of technique we will not cover under the psychotherapy process because there are too many concepts, too many ideas related to what happens in the therapy room. But we will definitely take an overview of some important concepts of how therapy gets done and what ideas are used. So, in its fully elaborated, exhaustive form, the psychotherapy process can be taken to be a synonym of technique. But since we are not taking the psychotherapy process phrase in that sense, we are taking it to be a part of technique. And we are saying some concepts which are not covered under this will be covered under technique differently, separately. So let us go into this psychotherapy process, and we will be focusing more on the psychoanalytic psychotherapy process and not on psychotherapy process of other schools outside of psychoanalysis, be it CBT, REBT, DBT or other such methods. Our discussion will be focused on technique of psychoanalysis, and in that context we will take a look at the psychotherapy process today. This series of sessions under the broad head of the psychotherapy process is a series of 8 sessions. Today is the first session of overview, and then 7 sessions, each dedicated to one element of the psychotherapy process. So these 8 short videos, short sessions will cover the psychotherapy process, and outside of these 8 sessions, there are some more videos on technique. All put together will cover the technique of psychoanalysis. Let us take a look at the psychotherapy process. The therapy process, in a generic sense, is a 7-step process. And this is true for any form of Western psychotherapy, not Eastern psychotherapy. Why so? What is so different about the Eastern psychotherapy process? I will leave it unaddressed for the moment. We'll discuss it some other time. But for the Western psychotherapy process, regardless of whether we talk about psychoanalysis, CBT, DBT, REBT, any form of therapy, in a generic sense, this is the 7-step process, which is a comprehensive process. Some therapist or analyst may not wish to use all the 7 steps and may use only a few of them, but this 7-step process is a comprehensive process. The first step in the psychotherapy process is the process of case history. When the client walks into the room, the first thing we do is to take the case history, which is to say, we ask the person what is the trouble, Why is he consulting us? And we ask him the life story, because the trouble that he has emerged out of a life story. The life story is the base, and from that base, a problem has emerged. And we also ask him how he has been dealing with this problem. Has he taken any prior treatment? Has he tried to do something to address it by himself with the help of friends? And if he has done something either in terms of professional treatment or self-addressal, what has worked and what has not worked, and how has the problem developed over a period of time? This is what we call is the case history. What are the details of case history? What are the constituents of case history? We will deal with in the next session, which is dedicated to case history. For each of the 7 elements, we have one session to go into details of each of the 7 elements. This session is dedicated to taking an overview of the 7 elements. So the first part of the therapy process is taking the case history. The moment a client enters, we take the case history, which is the history of life of the person and details of his complaints. After taking the case history, if we feel the need that certain things are not clear, or we want some more information about the unconscious mind of the person because we want to accelerate the whole process, or we feel certain information is hidden and has not been revealed, or we are not sure about our assessment of intensity, whether it is a mild problem, a moderate intensity problem, or a severe intensity problem. These are areas where we can take the help of psychological testing to help us in our decision making. In certain situations, it may be a legal necessity to provide a psychological test report, and there we don't have a choice but to go for step number 2. If we find that we are in a situation where neither it is a legal necessity nor an operational necessity, we are very clear about the case, then we may not do psychological testing. Every person who comes to us, we don't refer for psychological testing. In fact, in India, we hardly refer anybody to psychological testing unless it's a legal necessity or it's an extremely complicated situation. Because psychological testing means additional cost to the client. And in low income countries like India, many clients can't bear that cost. So most practitioners, 75% of the time in India, don't go for psychological testing. But it's a good practice to go for psychological testing if we can. Once we have the case history and the psychological test reports, we go to the third phase of diagnosis. That in view of the complaints and the characteristics of the complaints, the way the complaint has been developing, what is the diagnosis? And we there want to give a clinical label to the problem. And that clinical label we give usually relying on the language of DSM-5, Diagnostic and Statistical Manual, 5th edition, which is used by psychiatrists. In India, it is DSM-5. In USA, it is DSM-5. In certain countries of Europe, they use a separate manual for psychiatry called ICD, which is a WHO manual, whereas DSM-5 is American Psychiatric Association manual. So you can either use DSM-5 or ICD based upon the country you live and whatever the law prescribes. So once we have a diagnosis that the person is suffering from minor depression, major depression, bipolar 1, bipolar 2, generalized anxiety disorder, schizophrenia, whatever be the diagnosis, then we go to the next step of pathogenesis. Pathogenesis means whatever is the problem, how has it developed over the lifetime of the person? Did it start at 5 years of age or 15 years of age, or has it started just 2 months back? So when did the problem start? Why did the problem start? And once it started, how did it develop and how it branched off into more complicated manifestations? So we try to draw the whole tree of the pathology from the roots to its full manifestation at present. Here we have to rely upon the school in which we are trained. If we are trained in the Freudian psychoanalytic school, our pathogenesis of the problem will be different. For example, take depression. If the diagnosis is depression, then Freudian school will have a different explanation of why depression happens. Kleinian school will have a different explanation. OSHO school will have a different explanation. So based upon the school in which we are trained, we try to understand how the problem has developed and why the problem started in the first place. The more schools we know, more knowledge we can bring to bear upon this process. Step number 4. This is the most critical part of the whole process, because the treatment plan, the therapy, flows out of pathogenesis. We will try to heal something based upon our knowledge of why that problem has developed in the first place and how it has developed over time. So if we know the Freudian school, the Kleinian school, the Winnicottian school, the Cohesian school, the ISTDP school, we may not be masters in all. We may be deep in one and have perspectives of many, but that itself is a very rich basket of knowledge we can bring to bear upon pathogenesis. So if we have deep knowledge in psychoanalysis, then we can bring more than one school to bear upon this process, and we can use knowledge from multiple schools to arrive at pathogenesis. First, why did the problem start? Second, how did it develop over a period of time? Third, in view of this, to what the problem is likely to respond to in a positive way and to what it is likely to respond in a negative way, and therefore from pathogenesis flows the treatment plan. I should have written treatment plan instead of therapy here. It's a mistake. The treatment plan. And the treatment plan would have, let me just correct it right now. So step 5 is the treatment plan. And the treatment plan, so pathogenesis, once it is done, we are clear why the problem has developed, how the problem has developed, what is it responding to positive, what is it likely to respond to positively, what is it likely to respond to negatively. And from there, we move to the treatment plan. The treatment plan involves, one, it may involve only medication in certain cases. It may involve medication and therapy in certain cases. It may involve only therapy in certain cases. It may involve medication, therapy, and some form of holistic healing in certain cases. So the treatment plan differs, but we will be focusing on the treatment plan where therapy is the central element. So for us, step 5 will be essentially focusing on therapy, not focusing on other elements of the treatment plan, which can be there, often are there, and they should be there in most cases. It is not prudent or wise to believe only one element of treatment plan is omnipotent and nothing else is needed. In fact, if we make a combination of all the options that we have, not all the options, but as will be required, combinations. The combinations work better than a belief in a single omnipotent tool. So the fifth point is treatment plan, which in our case can be essentially centered around therapy. We will go in details of treatment plan in session 5. So this treatment plan in our case involves therapy. Let me just write it down so there is no confusion. So after pathogenesis, we create a treatment plan and we say this person needs medication, therapy can't help, or this person does not need medication, only therapy will help or should be sufficient, or this person requires therapy and medication both, or this person requires therapy, medication and holistic healing all put together. So we create a treatment plan. Different countries have different laws. In some countries, the therapist can decide the full treatment plan. In some countries, the psychiatrist can decide. In some countries, both of them decide individual parts. Our job is to present to the client all the options available with the cost benefit analysis of the options as we see it, the best way we can see it, and then allow the patient to make his own choices. If law mandates something, then of course there is no choice but to go by what the law says. Once we start therapy, then we have to take some sessions that we do to the supervisor. So supervision is a process where the therapist notes down after the session. After the session is over, the therapist notes down what happened between him and the patient and how the patient responded to various things. What worked, what did not work in his opinion. And that session transcript, that note of the session called transcript, it is called transcript. Transcript means it's verbatim record of what the patient said and what the therapist said. So he says, patient said X, then I said Y, then patient said Z, then I said A, then the patient said B. A verbatim record of what happened in the session. That is called transcript. It is taken for some sessions. So if you do 15 sessions, you don't do transcript for all the 15 sessions. Any session you select and you take the make the transcript of that session and take it to a senior therapist who is senior to you, called the supervisor, and discuss with him, maintaining full confidentiality of the client. As a third person, as a senior person, as an expert in the area, better person than I am, how do you see the therapy process? What is going right? What is going wrong? What needs a change? What can be done to accelerate the process so the healing can be faster and deeper? This is called step 6, supervision. In session 6 of this psychotherapy process, we'll go in details of supervision. 7th is termination. When the client says he is feeling fine, we go for termination. Now, on what basis do we decide it is time for termination? We will go into details in session 7. But for the moment, if the symptoms cease or the symptoms are substantially overcome and the client feels comfortable and wants to terminate, that should be enough of a reason to terminate. But this is not an exhaustive list of criteria. Termination is a slightly more comprehensive and deeper decision to make, and the criteria of termination will go into details of in session 7. When do we decide to terminate and on what criteria we take the decision? Freud has written an interesting paper on this, analysis terminable and interminable. So we see case history is the base of the entire psychotherapy process. That is the matrix from which everything emerges. It is very important for diagnosis, pathogenesis, treatment plan, prognosis. Prognosis means based on case history, diagnosis and pathogenesis, how do we predict based on our experience, which of course is provisional, nobody knows the future, but to the best of our experience, do we believe the sickness is going to reduce over time once we implement the treatment plan, or is the sickness such that even after implementation of the best of the treatment plans, it is going to worsen over a period of time because we don't have really a cure for the problem. So the prognosis, the prediction for the future can be good prognosis or bad prognosis. Usually in mild and moderate cases, we have good prognosis. In severe cases, it's a split. For some severe cases, we have good prognosis, and for a micro group of the severe cases, which is so severe that nothing can be done, we don't have any knowledge, we don't have any tools to arrest or reverse it. In such cases, it is bad prognosis. So case history is the base raw material for diagnosis, pathogenesis, prognosis, and treatment plan. So this is the 7-step psychotherapy process in a generic way. This is common to all forms of Western psychotherapy, regardless of whether any practitioner wants to use our 7 steps or skips a few steps, but this is a comprehensive process. The first is, let us review it. Client comes, we take the case history. Usually it takes 2 to 3 hours. In case history, we take the complete life story of the person and details about the complaints. Second phase is testing, which is optional. If at the end of case history we feel the need, we go for psychological testing and we get it done from an expert. Usually we don't do it because psychological testing is an extremely specialized area. Step 3 is based upon the information of the case history and psychological testing. We arrive at diagnosis. In some countries, law says only psychiatrist can diagnose. In some countries, therapists are also allowed to do the diagnosis. Diagnosis is usually based on two psychiatric manuals, DSM-5 or ICD. ICD is used in some European countries. DSM-5 very popularly used in India, in USA, and some countries in America, the American continent. DSM-5 seems to be more popular globally speaking than ICD. So, based upon the criteria given in ICD or DSM-5, using the information given in the first 2 parts, case history and psychological testing, we arrive at a diagnosis, a sickness label. What is the name of the problem the person is suffering from? And here we diagnose the person as suffering from generalized anxiety disorder, depression, addiction related problem, bipolar, a personality disorder, whatever be the problem the person has. We arrive at a label using information from case history and psychological testing and referencing that information to DSM-5 or ICD. After diagnosis, we come to the 4th step, pathogenesis. Why did the problem develop, when it developed, and how has it developed over a period of time? To what measures the problem should positively respond, to what measures the problem should negatively respond. And here we use our knowledge of schools of psychoanalysis, and each school develops its own pathology, its own pathogenesis. Knowledgeable and skilled therapists in psychoanalysis who have knowledge of multiple schools, they use knowledge of multiple schools to do a consolidated pathogenesis. From that follows the treatment plan, which can include medication, therapy, self-work, holistic healing, social involvement, spiritual involvement. However, we will focus here only on the aspect of therapy. That step number 5, for us, the focus will be therapy element of the treatment plan. So from pathogenesis, we evolve how to do therapy. And in details, we will go into what are the options we have at step 5 in doing therapy. Because if the pathogenesis is depression, there is a particular way in which we will have to customize our therapy. If the pathogenesis is personality disorder, there is a particular way in which we'll have to customize our therapy. If the pathogenesis, if the diagnosis is psychosis and the pathogenesis is very early life problem, we'll have to customize our therapy. So based upon step 3 and 4, what is the diagnosis, what is the pathogenesis, we will have to customize our way of doing therapy. We'll go into details of it in 5th session of this series. For each of the 7 points, we have one small session and one session overview, which we are doing right now. Once we start therapy and a few sessions are complete, we take transcript of any one session to the supervisor and discuss with him how to reduce our mistakes and how to do better job in therapy. And once the patient starts feeling well, symptoms cease or substantially reduced, and the patient feels good enough, people around the patient feel good enough, we also feel good enough that the patient has substantially healed, we go for termination of the therapy. And in termination, we take 2 to 3 sessions to terminate the therapy, to take a review and also undertake mourning of the separation from the therapist in the therapy space. So termination is a very important part of the therapy process. So this is the 7-step process of the generic 7-step process that constitutes the 7 steps. These are the generic 7 steps that constitute the psychotherapy process. Any questions on the overview of the generic psychotherapy process? Write to me at hveindia@gmail.com. Thank you.